Hi, today I'm going to work with you or show you a little bit of what we do in a dry eye assessment. Our patient here, Teagan, has gone through a comprehensive eye exam, and we found that there are indications of dry eye for several reasons, and we need to explore that a little bit further. It's more intensive testing than what we would do for dry specifically in a comprehensive eye exam. So liken it to when we maybe have to do a glaucoma exam. There's extra testing we have to do that can't fit into the time that we have allowed for comprehensive eye exams. All right, so we would start with getting a very extensive case history. There's several questionnaires that we have a patient fill in so that we could see exactly where they're struggling, and sort of start forming our treatment protocol that we would work with the patient. There's no one size fits all. Everybody's different. Some things work for some patients, some things don't, and that guides us to seeing where we can fit you into a schedule. So a little bit of Teagan's history. She is currently using warm compresses daily with drops, and she has a bit of allergies, seasonal mostly, and then she also used Accutane as a teenager to help with her skin problems. So we're going to run through a testing series so that you can see what it actually entails when you come in for a dry eye assessment. Firstly, we're going to have a look at her meibomian glands. We have a specialized camera that uses infrared light for us to be able to take a photo of her meibomian glands. And then just going to, is that okay? Mm-hmm. And then you'll see the photo there on the screen. We're just going to capture that. Very good. All right. I just have to get better. We've gone through all 4 of her lids. These are the top lids, they're the bottom ones. Teagan is only 22 years old, and already you can see she's lost glands, and the glands are very irregular. Her right eye is worse than the left one, so that's the top. The bottom one, even here she's lost, and they're very short. Left eye slightly better. So her warm compress and her teardrops and her omega-3 help, but we're going to have to do in-office treatment for also to really make sure that we get these glands that she has left functioning. She has to get to 90 years old, and if they look like this already, it's quite possible that by the time she's 40 or 50, severe dry eye is really a problem for her. We're going to do an inflammatory test. It looks just like a pregnancy test, but so what I'm going to do is I want to check the amount of inflammation she has in her tears. So we're going to do, this is called an MMP9 test, and we're going to check her tear layer. We're going to run it twice in the bottom lid. Let it soak up as much tears as possible, and then we have to let it cure for about 5 minutes, and then it will give us a positive or a negative for inflammation. All right, it feels a little uncomfortable because it does take up all the tears, but have a look up for me. Look up.
Sorry.
We've got an update on the MMP9 test. The control, we have a control line and then a line that shows if there's inflammation, and you'll see she's got a little red line there. So we know there's some underlying inflammation probably contributing to her dry eye disease. Okay, so we're going to measure the osmolarity of her tears now. And so we have a certain cutoff point where we know it's more dry eye related, or there's something else maybe that's bothering. Let's have a look. So we're going to do a slit lamp exam. So we're going to check the anatomy of her eye. We're going to check her tear layer and just check her lids, her lashes. So just a good sweep of the front of the eye. What I'm making note of is, so I'll ask Teagan to close both eyes for me, and then I'm having a run along her lids, and I'm noticing the makeup that's very powdery, and you're going to see now when we check her tear layer, a lot of that powder is going to be floating on her tears. So that's her top lid. You can open for me, please, Teagan. And then I want to check her bottom lids. So we're going right in. There we go. I'm going to change the lighting a little bit so it's easier for you to see. There we go. There we go. And you can see all the sparklies that she's got going there on her lids. And look down for me. And then what we're looking at is here where her lashes go into the lid. We're checking if she's got any little bugs between her lashes, so what we call demodex. All right, so this is the other eye, and we're going along her lash line. So closed eyes, you can see all the sparkly, glittery makeup all around her eye. And then open up, Teagan. And I want you to look up at the ceiling. Okay, I'm going to bring in the focus a little bit so we can have a look at her lash line, and we're looking if there are any little bugs there. Let's bring this out. There we go. For the most part, it's looking good. Look down for me. And I'm just going to check the top lid lash line, and we look very finely. I can increase the magnification again and see if we can get you to see any. Actually, right now it looks really good. Okay, now we're going to test what we call the tear breakup time. So we want to see how quickly Teagan's tear layer evaporates. I do this with most patients, so I'm sure all of you, somebody's done this for you before, maybe not realized what we were doing. Look up for me. We just put a dab of the dye, blink. Okay, and then I want you to blink again. Good, now just do a normal blink. And now we're going to count the number of seconds, and you can see the dark blue. All right, so we put some fluorescein dye in because I want to see how quickly Teagan's tears evaporate between blinks. So I want you to do one blink, Teagan, just a normal blink. Good, and again, and again. And then I want you to keep your eye open till I say blink. Okay, blink for me. And now we're counting, and you can blink. Okay, I got a tear breakup time of 4 seconds. This means that she has very dry eyes. I'd say moderate to almost severe. And then when we have a look at the inside of her lids, I'm actually wondering if she may be starting with a little bit of rosacea, maybe with these little red blood vessels here, which would make sense with the MMP9 that we did, because we saw that she has inflammation. And when you have a look, you can see the makeup floating on her tears. You see the little bright glitter hanging around every time she blinks, so that exacerbates things too. Mybum is actually coming out of her glands. So when I press, you can see most of them are letting the mybum out. You can see it like a little fountain almost as I push it. And it's soft. And I know Teagan is already doing home treatments, and we've done eye lux for her, so that's improved her meibomian gland function by leaps and bounds. The left eye is a little worse. We're not getting as many out, and some of those little glands are misplaced. They're not right along her tear line anymore. Summarize a little bit. Teagan has moderate dry eyes. We know there's inflammation. Her tears are evaporating very quickly between blinks. So I know she's doing omega-3, which helps with the inflammation. She hasn't been quite consistent, so we're going to get better at that. She's going to keep going with her warm compress and lid massage at home. But I do recommend that we do an eyelux for her, that we can do in-house treatment. We also need to change her makeup to a more cream-based and a mascara that actually is tested for dry eye patients. And also we need to watch what she's cleaning her eye makeup off with, because that can be as bad as using baby shampoo on your eyelids. It actually can make things worse. So we have to be mindful of what she's using. So it's a holistic picture we're looking at, not just, you know, oh, drops, and the drops are going to help. Yes, it's a patch, but I don't want her on drops consistently 6 or 7 times a day. We need her eyelids to actually work and do the function that they were made to do. Okay, so that concludes our testing for Teagan, and if you have any questions or would like to book yourself in for a full evaluation, just give us a call.